What do you think would be some of the best reforms that will make WHO more trusted?
WHO more effective. Whether that translates to more trust is another thing. They can be much more effective if member states provide sustainable financing and allow WHO to allocate those funds. The Trump administration has been trumpeting for a long, long time that WHO favored China during COVID, and that there was a lab leak and WHO refused to investigate it. Frankly, that's rubbish. I know from the inside that how much WHO did try to influence China.
Good afternoon, everyone, and welcome back to another episode of Global Health Uncensored, a podcast where we sit with global health leaders, practitioners, scholars, and trailblazers to have honest conversations about global health issues and the decisions behind public health outcomes. My name is Dr Banda, the host. Each episode brings a thoughtful voice to the table to reflect on experience, leadership, power, and the realities that shape impact in global health. Today, we are very honored to be joined by Professor Lawrence Gostin. He's a founding director of the O'Neill Institute for National and Global Health Law and distinguished university professor at Georgetown University. Professor Gostin is one of the most influential voices in global health law, public health ethics, human rights, and pandemic governance. His work has shaped how governments, institutions, and public health leaders think about the legal foundations of health, the limits of state power, and the responsibilities countries owe to one another in moments of crisis. So in this conversation, we will explore a timely and urgent question: who governs global health? Is it WHO? Is it powerful countries, donors, private industry, law markets, or moral responsibility? And as the world prepares for the next pandemic, we will also examine what global health law can and cannot do to ensure equity, accountability, and justice. With Professor Gostin joining us today, Global Health Uncensored continues to bring forward voices who help us go beyond slogans and headlines into the deeper questions of power, governance, rights, and the responsibilities that shape global health outcomes. Professor Gostin, it's an absolute honor to have you on our podcast.
Thank you for such a kind introduction. I really appreciate it.
Yeah, so Professor Gostin, you've really helped define the field of global health law. What was the moment that when you realized that law could be one of the most powerful tools for protecting public health?
Well, I don't know that there was one moment. I lived in the United Kingdom for 15 years, and my wife and family are from there. And I was the legal director for the National Association for Mental Health. And so I brought a lot of cases before the European Court of Human Rights and domestic courts, about civil and human rights of persons living with mental illness. And so that's where I started. And then I moved from London to Oxford, and then Oxford to Harvard, where I started working on the AIDS pandemic. And I think that was the biggest eye-opener about the importance of law, ethics, human rights in a major pandemic. It was probably right at the early stages of the AIDS pandemic when there was so much discrimination and ostracization and irrational fears. That really was a life-changing experience. I've often said that AIDS changed the world, and particularly social mobilization around HIV/AIDS, which really was completely transformative.
Okay. But I know you've had such an exciting career. But when you look back, what idea were you early to recognize that the global health community took too long to accept?
Well, I suppose it's, the fact that, we always thought that public health and human rights were in conflict. And I think people still think you need to take away people's liberty for the public's health. But I think the key singular insight is that while sometimes compulsory powers are needed, the vast majority of times human rights and public health and global health are synergistic. I basically have come to the view that, to advance global health and global health security, you need two fundamental things. You need many others, but these are the two fundamental things. One, I think you need scientific innovation and investment in science for vaccines, therapeutics, diagnostics, personal protection equipment. But the other thing I think that's needed is the equitable sharing of the benefits of that information. Everyone needs to benefit from science, and we've done a very bad job at equitably distributing, highly effective vaccines and treatments and other medical products to people in low and middle income countries and even poorer people in high income countries.
And I think one issue that has become central to the practice of global health, especially in recent times, it's people asking who actually governs global health as they continue to see how things are unfolding. In this episode, it's rightly titled "Who Governs Global Health." So, if I have to ask a direct question, who actually governs global health today? Is it WHO? Is it powerful countries? Is it donors, philanthropies, or it's a combination of these?
Actually, that's a very easy question, and the answer is no one. No one governs global health. It's a very, very fragmented, diverse governance system. And the governance system, we don't have a world enforcement or world compliance. Certainly, the World Health Organization, by its constitution, has the mandate to be a leader in global health. But I think everybody knows that WHO does not have the capacity or the trust of the world to be able to do that on its own. I still am a huge fan and admirer of WHO. I've worked with it for decades and decades. Its budget is very, very weak, and it doesn't hold the singular place that it did in the decades after it was formed in 1948, where it was basically the singular global health actor. Today, it operates in a sea of different governance arrangements, and also institutions. There's Gavi, the Global Fund, UNITAID, CEPI, and the list goes on and on and on. And of course, you've got big philanthropies like Bloomberg and the Gates Foundation and the Rockefeller Foundation that have been very, very active. I don't think anyone really governs global health. Each institution is governed differently. And even when we're dealing with a global health emergency, like COVID or now the Ebola outbreak in the DRC, or perhaps even hantavirus, it was very, very clear that no single entity is in charge. So, for example, with Ebola, WHO's health emergencies program is certainly on the ground, very, very active. Tedros, the head of WHO, was just on the ground in the DRC, is now back in Geneva. I saw him just before he left for the DRC. But also, I think Africa CDC plays a large role. And then the countries in the region, particularly the DRC, but also Uganda. Now there's a big controversy over an Ebola facility being stood up by the United States in Kenya. That has had a lot of pushback, both here in the United States and in Kenya.
I think one other issue that has become central in recent months is the pandemic agreement that was adopted in May 2025. But there is major implementation questions, especially around pathogen access and benefit sharing. In your view, you think this agreement a true breakthrough, or is a watered down compromise that states have to endure?
Yes, of course, it's a watered down compromise. I mean, there's a lot of nobody's willing to just be cooperative with one another. Everybody's, wanting their own view. And so the pandemic agreement, and particularly the pathogen access and benefit sharing system, has been highly controversial. I've been very much involved in drafting and negotiation and providing some assistance, particularly to African countries. But broadly speaking, remember the two major issues that I mentioned before. science and equity. To me, the pandemic agreement and the PABS annex should be a global public good, which means that we need to have scientific innovation and investment and sharing of scientific information. That's very clear to me. And equity is equally clear to me. And it shouldn't be one pitted against the other. We need actually both. But we found it very, very hard to get there. The truth is the pandemic agreement is not even in force yet. The World Health Assembly has stated that the pandemic agreement can't be open for signature until the PABS annex to the agreement is agreed. And it was supposed to be agreed at the World Health Assembly last month. The countries failed to reach agreement, and the Assembly's given the Intergovernmental Negotiating Body another year to be able to come to a conclusion. Will it be a compromise? Very likely. But I do think that if we can bring the pandemic agreement into force with a reasonably good PABS annex, and also we have amendments to the international health regulations, those will be two net benefits. International law is necessary for global solidarity, but it's not sufficient, and it's far from perfect.
Yeah. And I think one issue that a lot of people misunderstand is with the area of authority and limits within WHO. And I know as you said, you've worked with WHO for several years now. Many people expect WHO to lead during global health crisis, but we all know WHO often lacks the authority and times of funding or enforceable power to do what the public assumes it can do. So what does the world misunderstand about WHO in simple terms? Like when people hear WHO, realistically associate with it and what?
Yeah, the World Health Organization is a wonderful, complex, and flawed organization. You mentioned one of the things that people misunderstand. WHO can't require any country or any person to do anything, literally. They have no power, and their member states don't give them the power. So the idea that, for example, that the Trump administration has been trumpeting for a long, long time, that WHO favored China during COVID, and that there was a lab leak and WHO refused to investigate it. Frankly, that's rubbish. I mean, I know from the inside that how much WHO did try to influence China to allow an independent investigation on COVID origins and the like. But WHO can only do what its member states allow it to do and what its member states fund it to do. And they provide WHO precious little funding, and they are constantly curtailing WHO's moral and normative authority. So you get what you put in, and countries have just not put in what's needed for a real robust global health agency like the World Health Organization. And that's really fundamentally misunderstood.
Okay. What do you think would be some of the best reforms that will make WHO more trusted by both high income and low income countries?
WHO more effective. Whether that translates to more trust is another thing. They can be much more effective if member states provide sustainable financing and allow WHO to allocate those funds to the global health priorities and not to the pet project of the donor. And that would be a big step. The other is that member states need to get behind WHO, particularly when there's a health emergency and a crisis. We all need to stick together. WHO can get greater trust and greater moral authority through better health communication. And I've been in touch with their top health communicators. They understand this. I think WHO, if it made any error during the COVID pandemic, it made the same error as the US CDC and every other public health agency. It needs to tell the public honestly, this is what I know, this is what I don't know, and this is what I'm trying to find out. to learn what I don't know. And so the public needs to understand, and WHO and other public health agencies need to explain that science operates under uncertainty, and also science is iterative. It changes. If you change your mind about an epidemic based upon evolving evidence, that's a good thing. It's not a bad thing. I think the public hasn't understood that, and they've been fueled by Secretary Kennedy and the White House and under President Trump. But also now you have just really cacophony of health information that's coming through social media, influencers amplified by artificial intelligence. Nobody knows what to believe. You can't even go to the CDC website anymore because you don't know whether it's been politically controlled. And so there's a crisis of confidence in public health and public health information. I'm co-chairing a Nature Medicine Commission on quality health information for all, with the idea that good quality health information, reliable information, is a key determinant of health. But we have a long way to go.
And I think I follow you a lot on Twitter. So I understand the dynamics there when it comes to the fight against misinformation. One other word that has become that everybody uses now is equity. But during a crisis, equity often collapses when, for example, powerful countries protect themselves first. How should we define equity in a way that is legal and operationally feasible or meaning?
Basically, equity is fairness. It's not equality. You don't treat everybody equal, but you treat everybody in a fair and just way. And that means that, in many, many ways, but particularly when you're allocating life-saving medical technologies, you need to give lower income countries and poorer people a fair shot at getting access to that. And there are a lot of political barriers to that fairness because, governments want to protect their own people first. The whole idea of America First or the America First global health strategy is based upon the idea of me, we, our country, not yours. And so we need to try to understand that the best way to allocate medical resources is based upon need and where it will do the most benefit. I understand that countries owe a primary responsibility politically to their own people. That's not just true for the United States and Europe. It's also true in Africa and Latin America and other countries. And the whole idea of health sovereignty, which is very popular now, and particularly in sub-Saharan Africa, is the concept that we need to take responsibility for our own health and our own people. That means developing the science, the laboratories, the manufacturing capacity to make our own products. You might even call health sovereignty more health responsibility. It's a government's responsibility to ensure that their public is healthy and safe. But that's going to need some international cooperation and funding. We need to be able to fund the kind of scientific and laboratory infrastructure and manufacturing infrastructure that enables countries to develop their own products, particularly regions like the African region. And that's, I think, critically important. But we also need technology transfer. We need companies in Europe and North America to transfer some of their trade secrets to other countries. In the end, we'll all be better off because there'll be much less scarcity. If you've got high-income countries innovating and manufacturing, and you've got middle and lower-income countries innovating and manufacturing, you're just going to have less scarcity, more product. It's a win-win for everybody. Very, very hard to make that case in the international political community.
Yeah, you've been in the legal space. One topic that I've always looked forward to discussing is the issue of human rights. in public health emergencies. We all know during the COVID-19 pandemic, governments often enforce restrictive movements. Some closed schools, mandated vaccines, and use emergency powers. There's also a bit of a blowback from those measures. How should we balance public health protection with civil liberties?
Yeah, well, one thing to talk about is kind of let's think about that in the global sphere. Right now, the U.S. is standing up a quarantine and treatment facility in Kenya, violating, basically saying, it's okay for Kenya to care for U.S. citizens exposed to Ebola. We can offload that risk to them, but we don't want it here. It's just very insulting and wrong. The same thing with discriminatory travel restrictions that really impede the epidemic. I understand why the public, supports travel restrictions, but they never work and they actually can do some harm. But then at the country level, the question is, how do you balance public health, particularly in infectious diseases, with human rights? I think the first observation is the one that I've written about, which is that, for the most part, there's a synergy between human rights and public health. And that, if you decriminalize individuals, in the AIDS epidemic or in tuberculosis, you actually bring the epidemic out in the open, and it's much, much easier to deal with. If you respect cultures of people and their burial cultures in Africa, in the DRC, West Africa, Central Africa, you do that as well. But there will be times when there's a conflict. And I've always thought that you deal with it. My dad used to just deal with those kinds of things, just like common sense. There's no absolute principle. But I ask myself this question: how effective is this coercive power going to be? Will it really save lives, or is it just, political theater? And then I ask myself the question, how much am I imposing on the individual? How much am I asking them to sacrifice for the public good? And then I try to balance those two in a thoughtful way. I think that if something like, masking, compulsory masking, or even sometimes compulsory testing or treatment, or even isolation and quarantine, sometimes they're necessary if there's a really contagious disease and a person has been exposed or actually infected. But I don't want to put all the burden on the individual. And so I just make a common sense, thoughtful balancing of the two. It's not that hard to do. You just don't want to do anything crazy. You want to base it on science. You want to base it on a realistic risk assessment. And you want to use the least restrictive intervention that you can to achieve an important public purpose. And you don't want to be more coercive than you need to be. Looking back at some of the things during COVID, I think asking people to mask when they're in an airport or a plane, I don't have any trouble with that. If CDC can't require somebody to wear a mask going on a crowded aircraft in interstate or international travel during a pandemic, I really don't know what it can do. But then some of them, in retrospect, we overreacted. I think we needed to balance school closures against, children's education. And even with lockdowns, we needed to be much more careful and thoughtful about them.
Okay. A chunk of my followers are prospective graduate school applicants, graduate students, early career professionals, especially those interested in public or global health. I would have to ask a question about opportunities within the O'Neill Institute, especially for those who are not practicing lawyers. Are there any certificate courses or any classes that they can take that is available for them to get to understand the legal dynamics of global health? Because I think that technical public health tools may not be enough in these current times that we are in. So what opportunities are available for non-practicing lawyers?
Well, there need to be more. I mean, I go around the world and I can't tell you how many times I'm asked that question. You've got health ministers, you've got, very experienced physicians or public health officials that understand that law, governance, diplomacy are very important tools, and they want to learn it. We have had, executive courses. We want to increase those, and also one day we would also like to provide, a master's in global health law for non-lawyers, but it faces a little bit of bureaucracy at the law school and the university. But that's, I recognize that need very much.
Before you go there, so our final segment is mainly a very quick, a quick take segment where I ask short questions and then you offer your thoughts on those questions very briefly. So the first question is the most overused phrase in global health.
A lot of jargon used in global health, and that really kind of bothers me. There isn't one that comes to my mind, but sometimes I just kind of scratch my head at the new way of thinking about particular issues that just drive me crazy. And I'm, as I say, I'm a common sense kind of person. I'm not, super progressive or, wanting to do woke things or things. I just ask myself the question, is this necessary? Is it fair? Is it just?
Mm-hmm. Okay. So, what's the most underused tool in global health?
I mean, I would say normative tools, things that, like legal tools and legal determinants. I think WHO needs to do more about that. And countries also need to comply with existing, legal norms, but also create new norms that are stronger and better. Oh, and I do think of one thing that did bother me for the first question. I
Okay.
think calling injuries accidents I never like because they're preventable. And so you don't say a traffic accident, you say a traffic crash, because there are a lot of things you can do to prevent those things. In fact, injuries are one of the most preventable forms of public health and evidence.
Okay. Yeah, that sounds good. One lesson the world failed to learn from COVID-19.
I mean, I think to just cooperate with one another, to trust one another, and rather than always looking out for yourself, try to look out for, your neighbor, your community, your country, your world. We've just lost all moral conscience about caring for other people and other countries.
One legal reform that could save lives in the next pandemic.
I would say one legal reform that could save lives might be to prevent discrimination, discrimination against individuals, and also discrimination against countries. For example, during the COVID pandemic, South Africa reported the Omicron variant very quickly. It dynamically sequenced it. It shared it with the world, and yet they were slapped with travel and trade restrictions. That's just not helpful.
The biggest myth about WHO.
The biggest myth about WHO is that it has power, and it doesn't.
Okay, one book every global health student should read.
One book every global health student should read. Now that's, I don't want to include my own book. I've got this my global health security book, and I'm just finishing the next edition of the global health law book that'll be coming out, and it's also going to be open access, so anybody in the world can read it for free. I would say maybe the story of Jon Snow, or one of the great stories about how public health prevention is so much more important than cure, and that public health itself is much more important than medicine. Nobody understands that. I often do a little thought experiment, and I do it everywhere and around the world. And I say, would you want a perfect public health world? Safe food, clean water, good environment, no malaria, and all of that. Or would you like to get any medicine that you could or see any doctor everybody understands that the public health method is better. And yet we spend, just a couple of percentage of our health dollars on public health, and the rest goes to high technology medicine. That needs to shift.
Yeah. One thing that gives you hope about the next generation of public health professionals.
Yeah, I mean, I've thought about this particularly as an American, because, there's so much, people are in disbelief about what America is doing. And there's also seething anger. They paint America with a broad brush. It's not just the government, the Trump administration, but it's also the people. We elected them and all that. What gives me hope is I look around the world, and I see amazing scientists. I see humanitarians and doctors rushing into conflicts. I see advocates fighting for the right to health. That gives me a lot of confidence in the future.
Okay. Well, that's the end of our segment. Thank you so much for making the time. I know how busy you are and the importance of the work that you do. Before you go, any final words to our listeners, the entire global health community?
Just believe in the future. Take care of your neighbor, take care of your environment, and be a good person. Be decent and be honest. And that's what we need now.
Thank you so much. Folks, as you heard, be a good person, take care of your neighbor. This has been the Global Health Uncensored with Professor Lawrence Gostin of Georgetown University. This episode may be aired on Apple and Spotify podcasts. It may also be on YouTube, LinkedIn, and X. If you are new here, follow our channel and subscribe to our channel. Until next time, see you.
Conversation continues at the Scholars Table with Dr. Banda.